Symptoms, usually asymptomatic, often discovered occasionally when taking physical examination or imagological examination for other disease. Some patients have the symptom of lower back pain on the affected side. It is often not caused by renal cysts directly. Large-sized renal cysts, especially when the renal cyst happen intracapsular hemorrhage and get an infection, the patients would have the uncomfortable feelings as the lower back pain obviously. For example, if the renal cyst oppressed the ureter or the neck of renal calcium, it would cause hydronephrosis and a secondary infection. Then appears the symptom of lower back pain, fever, and urinary tract infection. Regular treatment therapies, surgery therapy, renal biopsy, conservative treatment. The advantage of our treatment mainly takes the treatment to inhibit the growth trend of cysts, to reduce the cyst fluid source, and to destroy the epithelial cells of the cysts, inhibit the secretion of cyst liquid, and stop the growing up of cysts, increase the excretion of cyst fluid, and the blood circulation and transparent of the surface of cysts, speed up the excretion of cyst fluid, make the cysts become retracted.
Hello everyone, welcome to Nephrologist live video undertaken by Beijing Tongshan Hospital of Traditional Chinese Medicine. I'm Betsy. This time our topic is polycystic kidney disease. We will introduce a patient case to you, and we have invited his major doctor. This doctor will explain the patient case.
This patient is a 48-year-old male from India. He has been hospitalized since September 2016. When the patient first admitted in the hospital, he suffered from polycystic kidney disease. His renal function had entered the end stage of renal failure, and at that time, creatinine level was 945. There was also severe anemia. Hemoglobin was only 60 grams per liter, and the abdominal circumference was extremely large. The abdomen was distended, and obvious mass can be detected with palpation. And at that time, the largest cyst in the patient's right kidney was 8.6 cm, which was reduced to 7.6 cm after 1 month's treatment with traditional Chinese medicine. This is a reattending patient. This time, he was hospitalized on June 17, 2008, and the creatinine for review this time was 632. During this period after continuous traditional Chinese medicine treatment, his condition has been very stable. He should have been undergoing dialysis, but our experts considered that the patient had good blood pressure, which controlled and kept well in the range of 110 and 70 to 120 and 70. Electrolyte was also controlled in the normal range. There is no acid-base disorder, no serious edema. Taking also the patient's own wishes into consideration, we decided to give conservative treatment for the time being, instead of dialysis. Finally, after many consultations by the experts group, patient's conservative treatment was very effective. The cyst was reduced, creatinine was reduced, urine volume was not reduced, blood pressure was normal, and the electrolyte was stable. The traditional Chinese medicine treatments we give to the patient and the time include external application of traditional Chinese medicine, oral traditional Chinese medicine, for fumigation and medicated bath of traditional Chinese medicine, as well as acupuncture and pulse therapy. The results of this time's review surprised the patient and his family, and our doctors were also very gratified. During the past 2 years of traditional Chinese medicine treatment, the largest cyst in the right kidney was reduced from 5.4 8.5 by 8.5 centimeter to 3.5 by 3.5 centimeter. Now the patient's abdomen is flat, no longer distended, and the abdominal circumference is normal. No mass can be detected with palpation. If patient continues a treatment like this, it is believed that he can maintain a more stable stage. As we all know, polycystic kidney disease has no specific treatment method in Western medicine. Everyone feels very surprised that the patient who was on the verge of dialysis had such a good treatment result. The key point is that our experts group has conducted many consultations for him and had a full understanding of his condition, so they could prescribe the right medicine. Moreover, the patient had strictly followed the doctor's advice. He has performed very well in his diet and daily life according to the doctor's advice. And the beginning, the patient's hope was just that he didn't want to have hemodialysis, which was an unreachable hope in their country. But now, in China, this goal has been achieved for him. Finally, I hope all patients can have the same good luck as this Indian patient and can have the opportunity to come to Beijing Tongshan Hospital of Traditional Chinese Medicine, can receive the systematic traditional Chinese medicine treatment. Thus, we can get the opportunity to help them to recover.
Okay, according to the doctor's explanation, we can see this patient get big improvement from our traditional Chinese treatment and medicine. His cyst was reduced from 8 to 5 cm to 3 to 5 cm. We are very happy to hear this news. Then many people may ask, how does the patient feel by himself, or what about our hospital treatment or the service? So now let's watch another video. Patient will tell his story by himself.
मैं जितेंद्र सिंह, ये मेरा छोटा भाई है सुरिंदर। इसकी पॉलीसिस्टिक किडनीज थी, जिसका हमने इंडिया में दिखाया, इलाज कराया, पर वहाँ पे इसका कोई हमें ठीक इलाज नहीं मिला। तो हमें किसी ने सजेस्ट किया चाइना में इसका इलाज है, चाइनीज़ थेरेपी और चाइनीज़ मेडिसिन से। तो हम यहाँ आए थे 2 साल पहले और यहाँ हमने इसकी थेरेपीज़ और चाइनीज़ इलाज शुरू किया, जिसके बाद इसके सिस्ट छोटे होने शुरू हुए। हम यहाँ 2-3 बार आए हैं इलाज के लिए, बहुत अच्छा वो हुआ। इसके सिस्ट भी छोटे हो गए हैं, क्रेटिन लेवल भी डाउन हो गया है और यह बहुत अच्छा फील कर रहा है। यह अब अपने काम पे जाता है, बगैर अपने आप को नॉर्मल सा फील करने लगा है। हम 2-3 बार इसीलिए आए हैं बार बार। यहाँ इलाज चाइनीज़ मेडिसिन से और थेरेपी से अच्छा हुआ और हम इस इलाज से खुश हैं।
तो मैं सुरिंदर सिंह इंडिया से आया हूँ इलाज के लिए यहाँ पे चाइना में। हमें नेट में सर्च किया, अभी चाइना में थेरेपीज़ के थ्रू इलाज है, तो यहाँ पे हम आए, हमें काफ़ी अच्छा इलाज मिला। और यहाँ पे आने के बाद 3 बार हम आ चुके हैं। आने के बाद यहाँ पे मेरा जो क्रेटिन लेवल भी काफ़ी डाउन हो गया है, सिस्ट भी काफ़ी छोटे हो गए हैं और वैसे भी शरीर में भी काफ़ी अच्छी वो है, भी ठीक है। अब थकावट वगैरह नहीं होती है जैसे हुआ है, शरीर का वो भी ठीक है, काम कुम पे जाता हूँ। अब ठीक हूँ मैं वैसे अपने आगे से।
Okay, today our live video will stop here. If you have any other question about kidney disease, you can leave message to us. We will try to contact with you soon. We'll see you next time. Bye bye.